to every woman that once you realize you have breast, you begin to check breast. So when we have a talk with a young lady that she's getting her first bra, we need to start having that same talk to say, now you really need to be aware of the changes. So we have it written as at the age of 40 began mammograms, but there is a higher number of women under that age diagnosed with breast cancer. So we're missing a group of women because these women feel like I'm not over 40, so I can't have breast cancer. Well, not only in breast cancer, but breast health, there are different, and Dr. Ray can attest to this, there are different things in breast that are benign, which we consider good, that can occur in breast tissue at any point. And so I say, number one, every woman needs to have their notebook, because we know what questions are going to be asked every time we go to the doctor. From the time you're a woman and you first go until the time of, good Lord saying this time is gone, a doctor's going to look at you and ask you when did you start your menstrual cycle. They're going to ask you medications. They're going to ask you that even if you know you can't have children, if you go in, can you be pregnant? Are you having issues? So keep that notebook. And keep that notebook, and because you can think you had a mammogram a year ago and it was 2 years ago, be prepared to know that mammograms have changed. Mammograms now, the technology is with 3D, and mammograms will create some discomfort for women, but as a whole, know when your cycle is, when you're getting your mammogram. And women say, well, I'm not worried about my cycle. But remember, your body's still hormonally. There are certain times that it's a tenderness or it's a little bit more difficult to have a mammogram. So be aware of that. But the key is, for every woman that is on this call, any man that's on this call, we know that if you have children or a loved one, you can see them. And they can walk into the room. And I use this analogy with every patient. If you have a child, a husband, a loved one, they come in the room and you look at them and say, what's wrong with you? Have you ate today? What's going on? But you can't see yourself. So also lean to whoever that person is in your life that is your accountability partner, your loved one, and make sure they're taking a look also. And I'm going to be candid, as I am. I'm married, so I always say that my physicians and my husband, Lord, no, my husband, my husband, don't shake your head, Dr. Ray, only run.
No judgment.
But, okay, so my husband and my physicians, I get my regular checkups. So if there's something that I am not noticing, I'm looking to them to speak up. And one of the controversial things is they're telling, this time where they told women don't do self-breast exams. The reason they said that is because you can't always feel a lump. But there are some breast changes that are visible and you still are able to notice a difference. So I tell people, if it changes, speak up. Don't take, and not only your breast, but your whole body. If it changes, take that time to make your appointment. Take that time to take care of you. And typically what happens is once a woman is diagnosed with breast cancer, they get an entourage of physicians. Dr. Ray has patients that he has been with, and it's a yearly check now. And he sees them and they say, well, why do I come every year? And I said, because this was the person on your team that began with you. He is making a check to evaluate. So when my women say, well, I don't have to see a Dr. Ray anymore. Yes, you do. But keep that notebook, because as we all mature, a year ago could be 5 years ago. And that 5 years can make a difference between an early stage of any disease and a latter stage. So every woman, get you a spiral notebook, get you something, put some pockets, holes in there, look at lab work. When you go in, it's like buying a car. You tell your physician the updates, and then he and does analysis from there, and it makes it a better, more cohesive visit. It makes you feel a takeaway that all of your questions and concerns were answered.
You know, I think women, and actually in general, we should all be aggressive with, and when I mean aggressive, I mean, you know, and I've seen this before where you go to a doctor and it happens to me, you know, a doctor sees me and just assumes that, you know, I don't know what I'm talking about, or, you know, they don't need this test done or this study. And unfortunately, I think with minorities, we're kind of dismissed, you know, at the time where we see it, you know, the doctor, the provider. And, you know, I've seen patients of all ages and all races, all sexes who have cancer, you know, and cancer does not care. It's kind of like the coronavirus. It does not, say who is going to get it. Basically anybody can, you know, so if you feel something's wrong or feel some changes in your body, you know, definitely speak up about it and get tested and get the imaging studies done. So that was just one thing I just wanted to kind of touch base on.